The people here are suffering from a devastating disease. It's shocking.
We've never seen anything like this anywhere else.
This is our first time in Ethiopia. We're always excited to go into a new country because that means we're expanding our mission and our work. We're here in Soto, Ethiopia. We're partnering with the Mossy Foot Foundation, and I don't know much about the work of this organization except it helps prevent this disease of Mossy Foot.
Mossy Foot disease is caused by volcanic glass that penetrates through the pores in their feet and gets into the lymphatic system. Wow. It's just all through the soil. And in Soto, that's especially significant because about 80% of the people here are farmers. So many of them have been barefoot in the soil, and about 1 in 13 develops an inflammation. They're the ones who get the disease. It can be eradicated through people wearing shoes. We have a lot of brand new patients today, and their feet are really bad, so be prepared for that.
Okay. Mossy Foot, basically, it is an easily preventable disease, but most people can't afford shoes, and they just don't have the education here to understand.
In the beginning, people's feet swell and itch, and then they get bigger and bigger. They become very disfigured. They're social outcasts.
Yeah.
And there's a lot of superstition, but we educate them here so that they know what causes it. But treatment is very simple. We're just washing the feet real well with soap and water, and then soaking in a diluted bleach solution every day. Are you up to washing feet?
We can start over here.
You want to start right here, Daniel?
Andreas.
Hello.
Andreas. Steven get it.
Andreas.
My name is Andreas. I am 16 years old. When I was a child, my Mossy Foot started, but it was not this big. I try to care for my wound, but can't because I just poor person. My mother died when I was a child. My father was sick with Mossy Foot, and then after a while he just died without any treatment. So nobody cared for me. I am outcast already. I can't go there, here. Friends and neighbors won't talk with me, so I can't communicate with society very well.
So how far does he have to walk here?
2 hours.
2
2 hours to walk.
The communities here are so spread out and they have no means of traveling. They don't have cars, and their feet are their only ways of getting around. And if those feet are diseased, then they can't walk, then they can't go anywhere. And it's very much like being a prisoner in their own home. Does he ever think he'll have a normal foot again?
If God says so, my feet will get better.
He keeps having you repeat and he can't hear it. Why is he?
Both ears they can hear, but they hear slow, very slow, little bit.
Can you let him know that that's what we do well is we do hearing aids. Does he want help?
Thank you, he's saying.
Thank you.
All right. We will see you soon then. One of the things we can do is we can help him with his hearing and maybe try to build his confidence. Every week, Daniel provides shoes and medicine for people in need who can't walk to the clinic.
So this man, Mequoso, his feet is the worst case I have ever seen.
Oh, yeah.
He's very neglected and outcasted.
Hello?
Mequoso. I'm Steven.
Hi, Steven. How are you? You try not to look and you try not to stare because these people are constantly shunned by society. And I wanted to focus in on who he is and not just his disease. How long have you had Mossy Foot?
I could not afford to go to Sodo every day, every time to get my medicine.
How long has it been since he's left this area?
20 years. 20 years. I want to introduce you to my children.
I would love to meet them. Hello. Now, are you guys aware of how Mossy Foot is caused?
They don't know.
I think that was the biggest shock with Mequoso is he has the worst case of Mossy Foot that anyone has ever seen, and his 5 children have no idea how their father got the disease. It was a pleasure to meet you. Listening to Mequoso's story, I have to find some way to help him.
This was the mission compound, and then across here, that was the old hospital where my dad worked so many years. He was the only doctor there for over 1 million people.
I guess he was busy. Huh?
He was very busy. Oh,
Hey, good to see you.
This is Daniel, and this is Andreas. He's a Mossy Foot patient, and he's been hard of hearing for a few years now. So I thought you guys could help him.
Sure, I'll take a look with the ear lights.
You want him to go over here?
We see a lot of hearing loss in impoverished areas like Ethiopia because they don't have the same basic access to health care that we have in the U.S.
Hey. Look.
Yes, I can hear he saying.
It's all in the eye.
opens up the world to them.
Now he's good.
You like it?
Now I can hear, and I'm feeling very happy. I want to thank God as well. The most important thing I want is to get healthy, get fine.
How long would a condition like this take to become normal?
More than 1 year.
1
More
year?
than 1 year, yeah.
So this is affecting all the way up to here?
Up to here, he has problem inside his
All the way hip.
urinating area.
Oh, they want Bill in there? Bill, they want you to come in.
Yeah, sure. Okay. Ay. This originally came from the Mossy Foot up the leg?
This affected by the Mossy Foot the same way. He says it's spreading all over.
Ay. That's too bad. Oh. On the inside of his right thigh, this tumor was growing and it was very deformed and it looked really bad. Okay, what I think I need to do is, if there's a doctor that you think is competent, you would take him to the doctor, and then I will pay for it if he has some treatment he needs.
Okay.
You'd have to see what I saw. It's not good. So, we just hope that this tumor is not a malignant, really aggressive tumor. To have $1 million smile like that, whenever you're hurting like that, that's pretty good. We hope that this procedure is going to save his life.
Mequoso definitely is the worst case of Mossy Foot that anybody's ever seen. He's trying to support 5 young kids, and he has no way of doing that.
Mequoso.
Hey, Mequoso. How are you? Good to see you. I came back, I brought shoes for your kids.
Thank you very much, Aga.
You're welcome.
Thank you very much.
Do you want to sit? I was honored to meet you and hear your stories and see how proud you were. And can you let him know that I've been talking to Sharon at Mossy Foot, and she's helped me find a surgeon that can take care of your feet, and I will pay for the surgery and the care.
God bless you very much. I have never been happier before like this, and I am very happy. Thank you very much.
You're welcome.
So you'll get better. Get better.
I'm very happy.
I'll tell him I have 2 children and I can't imagine not being able to play with them and take them out to show them what I've learned. He's lived this way for 20 years and it got me thinking about the lack of understanding what this problem is and how you prevent it. And that's with education. These might work for you. That's how you can really start to curb this disease. It matches your shirt. If someone had done that for Mequoso, he would have the last 20 years of his life back. He's a good man and a good father. You're a good person.
Thank you very much.
You're welcome. Bye. Can you let her know we're gonna clean their feet and then we're gonna let them dry and then we're gonna give them shoes. The whole goal of today was to hand out a little over 300 pairs of shoes to the children of this area and help educate them on how they can prevent this problem, which is one of the biggest challenges because their illiteracy rate is so high in this area.
If you play or walk in the dirt without shoes, you get Mossy Foot.
Starkey and Mossy Foot are both really passionate about helping out impoverished people to give them the tools that are necessary to be able to cope with life and be successful.
Good morning.
Siedi, wasiaga.
Bill, you have an official helper.
Hey, you got a shirt too.
That's
Hey,
it.
good. All right.
So he's going to hand out the medals.
Good. It won't be long. Ba, 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 ba. It's good. Ba, ba, ba. Right there. Okay, doctor. My assistant is ready with the medals. Okay, he likes it. Okay, he's ready. No, I don't think I'll ever forget Andreas' smile. I think that's why I care about Andreas, because I've never seen anyone that's that bad. That has a smile on his face. It's special. Sharon is a great example of a lesson that her father taught of respect for life and caring. And now we see her carrying this mission forward, and we hope to teach that lesson to others so we can have a much larger impact on the world.
Muleba halidia tasong tara baban kamasha sha besis galatis